After 42 units of Botox in 5 days, I see no difference. I can fully move my forehead, eyebrows, and the sides of my eyes. All I have had is a slight headache since the injections.
Thank you for your question. You stated in your question that it has been 5 days since your Botox injection of exactly 42 units, and you've submitted 3 photos demonstrating your ability to squint your eyes, to raise your eyebrows, and to frown. And these are the typical 3 areas of botulinum injection that's performed routinely, and certainly 42 units is an appropriate dosage. Well, I can give you a little bit of guidance as far as my perception from the photos you submitted in your question. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been practicing in Manhattan and Long Island for over 20 years, and as an aside, oculoplastic surgery as a group was one of the first group of doctors to use botulinum toxin because of the indication originally for facial spasms, spasms affecting the eyes and the rest of the face. So certainly I have a lot of experience using Botox, and I can certainly see why you're concerned. Now, as a general rule of thumb, and if you have experience having undergone Botox injection, then you're probably aware that the onset of effect can take about 3 days, and the peak of the effect is at about 2 weeks. So at 5 days, it would have to be a question of whether or not you feel that your movement is as strong as it was prior to injection, which I think would be unusual. So assuming that that's the case, you can certainly reach out to your doctor and ask about this. You know, as someone who had a large group of patients who I've been taking care of for years, I get to know my patients in terms of their desired results and the ideal dosages, and I record these on my chart, so I know when what kind of amounts work best for each individual patient. Now, there are going to be times when people need a little bit more, or sometimes when they need a little less. As time goes on, if you use Botox continuously, the muscles tend to actually relax more and actually thin. So sometimes you actually need less Botox. In other situations, there could be a point where a person may actually develop some degree of resistance. Now, there can be a lot of different reasons for it. In some patients, it could be antibodies to Botox, which is possible. That can actually negate the effect, or it could be a tolerance. It is an individual case-by-case basis. And the simplest possibility is that the vial of Botox, maybe when it was reconstituted, it wasn't a good vial, or maybe it wasn't a vial that was agitated. There's been a lot of discussion in our field about treating these vials very, very delicately, where you don't shake a vial like you do with an antibiotic. But I think there are some people who disagree with that, and certainly have been able to show that they can agitate a vial and still get good results. Again, this is still it's reasonable to actually ask this question, but also I would say it's also reasonable to wait the full 2 weeks, because there may be a change. We tell our patients in our practice that routinely for injectables, whether it's for Botox, whether it's for Restylane or Juvederm, we tell patients to allow about 2 weeks for things to settle in, and then to come in for a follow-up appointment, and we evaluate at that time to see how things look. And then we can always add, let's say for Botox, a little bit more if appropriate. If there's no movement, then there's no reason. And again, there's also a gradation. A lot of people prefer some movement, some prefer no movement, some people partial movement. I mean, there's going to be different levels for each individual. So if you feel like if you've been going to the same doctor for a while and you feel like this is unusual, then certainly having a relationship with that doctor and figuring out what went on, it's important. Otherwise, it might just mean that you just need to try again and have another injection and see if it works. But I would allow about a full 2 weeks. You don't want to unnecessarily dose an area and set the bar at a much higher dose than is necessary. It's kind of wasteful and not appropriate. So I would suggest again, contact your doctor, find out what their thoughts are about your situation, and chances are they will probably want to recommend that you wait or even come in to take a look and see what's going on. Everybody's got different schedules, and sometimes they can't wait the full 2 weeks because of important events and things like that. So I hope that was helpful. I wish you the best of luck, and thank you for your question.